Welcome to the Dallas ISD School Health Advisory Council, otherwise known as SHAC, Orientation Training. This training is divided into 3 sections. This is the first section, and it will cover what a SHAC is and why we need it. For the first time in history, the current adolescent population is predicted to not outlive their parents. Many lifestyle choices are the leading cause of this statistic, such as increased unhealthy eating habits, decreased physical activity, increased alcohol and drug use, increased sexually transmitted diseases, increased bullying, decreased amount of sleep, increased pollution, increase in asthma cases, and increased teen pregnancy rates. The reality is that all children are at risk, but there is something you can do about it. These 6 behaviors account for premature deaths and illnesses, and they are all lifestyle choices, not diseases. The common factor between these behaviors is that they are all preventable. School health is important because it not only helps children avoid risky behaviors, but more and more research is also proving that healthy kids learn better, healthy kids miss less school, healthy kids present fewer behavior problems, healthy kids have better attitudes, and healthy kids stay in school. Schools should also be concerned about the relationship between risk behaviors and academic achievement. After controlling for sex, race, ethnicity, and grade level, data from 2009 risk behavior surveys show students with higher grades are less likely to engage in health risk behaviors than their classmates with lower grades, and students who do not engage in health risk behaviors receive higher grades than their classmates who do engage in health risk behaviors. A child's health is the parent's responsibility, but do they have to do it alone? Children are in school for an average of 7 hours per day, and many children have 2 meals at school. Parents alone cannot address all the issues children face today. Schools, parents, and the community must work as a team to teach, reinforce, and model healthy behaviors. What can we do? We need strong, informed leadership in our schools to truly have an impact. Each district needs a school health advisory council. So, what is a school health advisory council? State Representative Garnett E. Coleman said the true legislative intent of Section TEC 28.004 was to create local school health education issues within the district and not just to define the parameters of sexuality instruction. Effective SHACs can be instrumental in creating healthy schools by providing a way for community members and school personnel to accomplish goals, influencing people within a community to be a credible, collective voice for healthy children and youth, providing a forum for sharing youth health information, resources, perspectives, and a range of advice, fostering cooperation by building trust and consensus among grassroots organizations, community segments, and diverse citizens. So, what is the role of SHAC? Most commonly, SHACs will be assigned the following responsibilities: program planning, promotion and advocacy, district and state agency interaction, district school board interaction, and evaluation, accountability, and quality control. The state requires that SHACs consist of 50% or more students' parents who are not employees of the district. The goal of the Dallas ISD SHAC is to include representation from all areas of the district, as well as a diverse representation of community members. The Dallas ISD SHAC is structured so that a parent and community member co-chair for a 2-year term. Subcommittees are established at the beginning of the year so that each member can find a specific cause they would like to devote their attention to. The CSH leadership team collaborates with the SHAC co-chairs to establish goals and action steps and to ensure their recommendations are shared with the Board of Trustees in an annual report. This concludes Part 1 of School Health Advisory Council training. You can now proceed to Part 2.